Good morning or good afternoon. While our audience is filtering in, please give us a few additional seconds. Thank you.
Good morning and good afternoon to our distinguished speakers and members in the audience. I'm Flory Lazier, President and CEO of Corporate Council on Africa, the leading U.S. business association focused solely on connecting business interests in Africa. I want to personally thank you all for taking the time to join us today for our second and final session on COVID vaccine acquisition and delivery. We are delighted to feature today a panel of private sector experts directly involved with the COVID vaccine distribution across Africa. Today's moderated discussion will highlight the critical role of infrastructure in African governments' push to vaccinate their populations. Collaboration between the public and private sectors will be critical in the coming months to achieve widespread inoculation. The strategies discussed in today's forum will highlight the strategies that utilize current infrastructure and technology to administer vaccinations more effectively going forward from this point. I would like to thank our forum's premier sponsor, Citi, for their support. To moderate today's discussion, I'm delighted to introduce Gerar Radavosian, Executive Director at Gilead Sciences. In his role, Gerar leads government and multilateral engagement for a portfolio that includes global health, Africa, Asia, Central America, and the Caribbean. Before I turn it over to Gerar, I just want to go over some housekeeping rules for the question and answer period. Please use the Zoom chat function to send us your questions. We look forward to asking them should time permit. We will only take questions from those who have provided their name and affiliation. So please do remember when you send in your questions in the chat to include both your name and your affiliation. So without further ado, let me welcome Gerar Radavosian of Gilead Sciences. Thank you, Gerar.
Lori, thank you so much. A warm welcome to our panelists and all the participants who have joined from all around the world. Thank you to Flory and the CCA team for hosting this two-part series to highlight the role of the public-private partnerships in closing the vaccine financing gap and tackling the logistics related to vaccine delivery in Africa. I'm Gerar Radavosian, Executive Director of International Government Affairs for Gilead, as Flory said. Gilead is a biopharmaceutical company working to transform and simplify care for people with life-threatening diseases around the world. And we know too well that medicines to address the challenges that, we know too well that it takes more than medicines is what I was going to say. And I know most of you do as well, that to address the challenges that people and communities face take more to than just access and prevention challenges. That is why we strive to build sustainable partnerships with governments and organizations to launch access programs and address the complex ecosystems that drives better health. And we do this for HIV, we do this for viral hepatitis, and we do this for COVID-19 as well. Today, I have the distinct honor of serving as the moderator. We have a great presentation prepared. And let me ask my panelists as well to turn on their screens, please. Great. We are in the midst of fighting a global pandemic, and I can't think of a topic more important today. Many of the countries across the continent are still feeling the brunt of COVID-19. And while access to vaccines are slowly increasing, we are nowhere near the finish line. Today, in addition to perspectives from the government sector, we have representatives from leading companies, that in transport and delivery, as well as in packaging and cold chain operations. All of these players are critical stakeholders, as you'll hear today. Their breadth of experience and expertise is a demonstration of how it really takes a village to ensure that medicines get from the clinical discovery phase and into people's arms. So with that, I'm going to start with Dr. Mercy Mwangangi. Dr. Mercy, she is the Chief Administrative Secretary of the Ministry of Health in the Republic of Kenya. Dr. Mercy is a medical doctor and has a master's degree in health economics and policy. She contributed to the design and implementation of the Universal Health Coverage Pilot Program in Kenya, which many of us know was a major presidential priority for President Kenyatta. Dr. Mercy, we are looking forward to hearing about your perspectives from Kenya and how the government is responding to COVID-19. Tell us about vaccine deployment in Kenya. Welcome.
Thank you. Thank you so much for this opportunity to join you today to discuss such an important topic, particularly as we fight the COVID-19 pandemic. And in terms of looking at Kenya's deployment plan, it becomes important for me to share with you how we've organized ourselves, particularly when it comes to the governance of the pandemic, because it's absolutely crucial to ensure that the clogs work in terms of governance. We've put together a multi-sectoral task team. We call it the Vaccine Deployment Task Force. And within this team, we have expertise from different sectors across the country. We have people in private sector in that committee. We have people who have logistics expertise in that committee. Of course, we have professionals, who are able to, give us technical support when it comes to vaccine utility. And what is special about how we put the team together is that we've been able to sort of, bring a broad range of expertise together. And most importantly, this is really resonating with why we are here today, is that there's a heavy focus and presence of the private sector in this team, because we appreciate as a country that the private sector is absolutely crucial as a partner. And Kenya perhaps is a little bit special because even outside of COVID, health provision is actually shared 50-50 between government and private sector. And so this collaboration is ongoing as we try and deploy our vaccines. So far, so good. We had an initial stock dose of about 1.1 million doses. We are hurtling through towards the 600,000 mark in terms of Kenyans who've been able to receive the vaccines. I must say we've got a lot of enthusiasm, particularly in the most vulnerable groups, those who are over 58. And in terms of our supplies, we actually don't have enough stock to be able to meet that demand, particularly as we wait for our second consignment. And so I can say right now the program is running on very well structured, touching on key elements of what it means to deploy a new technology in the country. We have a strong arm that's looking at communications, trying to talk to the citizens, trying to explain to them why it's important for them to have the vaccine. We have another very strong arm, which I think is particularly important for our discussion today, regulatory affairs. So working hand in hand with our regulatory agency, we are monitoring adverse effects following immunization. We're looking and perhaps even learning, is our regulatory framework adapt and agile enough for an emergency situation, which is, COVID-19 pandemic. And so great learnings already are emerging from this space. We have a team that deals with supply chain issues, a team that deals with logistics. I can tell you again, lessons learned, particularly from being able to move the vaccine and ensure that it's a viable vaccine all the way to the last health facility across the country. Great learnings again in terms of how we were able to do that. In fact, I remember in the beginning when we were trying to work out the plan right before we started our vaccination exercise, we had the pleasure of engaging with different logistic companies who don't specifically deal with health, but are involved in logistic frameworks. So we were talking to DHL and many other companies, Coca-Cola. How are you able to maintain that supply chain to the very last store across the country, or across the different existing spots across the world? And so we've been able to make sure our vaccines do get to the farthest end of Kenya, the north and the south, and the process is underway in terms of the citizens receiving the vaccine. I think another key thing that's quite important is to really appreciate the infrastructure that's required, perhaps beyond the cold chain infrastructure that people perhaps think is the key thing that you need. We've come to learn that health information systems are absolutely crucial. for you to be able to deploy vaccines and monitor and track batch numbers, be able to follow through all the way to, where the vaccine gets into the muscle, and be able to sort of have that very clear, and then have it come back to you in terms of returns from the health facilities. So then, enable us to be able to deploy and replenish their stocks of vaccines. It's been very interesting, and we're lucky in Kenya that we were able to develop our own homegrown solution together with the Ministry of ICT to deploy it, and that's what we're using. Learnings in the beginning, a few hiccups here and there, but the system now is much more robust and is giving us the information that we require. I think it's also important, perhaps, in the grand scheme of things, even as we move forward with this deployment of the COVID-19 vaccine, is to then understand as a country, it's become very important to, really have reflection on what it means to be self-reliant, to have reflections on what it means to actually be able to deploy an intervention and to do it very quickly. We all appreciate for us to be able to really defeat this pandemic, we need the vaccines here and now and in the proportions that we need them. But because of the challenges that are there in terms of global supply chains, we are reflecting on very key lessons. Is it time that Kenya made investments, particularly in vaccine manufacturing, in R&D, in reconstitution of these vaccines? And because we really do affirm that this is the time, then the question becomes, who are those people that we can partner with to make this happen? And I'm happy to see Gilead here, and I'm happy to see all the other stakeholders who have logged in today, because we are out there, we're willing, we're able, and right now it's arms wide open for partnerships that really, drive us towards the journey of self-reliance. So thank you. I have a lot to say about what we're doing. I'm hoping I haven't gone over my time, but I remain available for more discussions on this. Thank you. Over to you.
Thank you. No, thank you, Dr. Mercer. That was great. And I know we'll come back to some of the issues that you've already raised related to infrastructure and other logistical issues. So I'm glad you mentioned that at the top. Encouraging actions already from the Kenyan government. Let me ask you also about some challenges that you faced in these early days. Can you share more about that, please?
Thank you. I think for us, and perhaps the world over, one of the biggest challenges we faced was vaccine hesitancy, and perhaps a challenge that we all need to accept and recognize, and almost even validate the concerns of the citizenry across the world, who are in the throes of a pandemic, a disease that has ravaged the world, and here comes a vaccine that's sort of turned around very quickly. And really, I think, it's one of those challenges that has a silver lining, because on one end, you appreciate that when we all come together, global world coming together to make this happen, that we can move and we can actually progress perhaps and sort of cut off a few years in terms of development of these products. And that's a good thing. And I think we need to latch onto that as the world and really ask ourselves, how do we do this for the next disease? How do we do this for cancer? How do we do this for many other therapies that are required? So that's very important. But at the same time, it means that the human race requires some form of, should I say, community entry, or sort of some form of, governments need to invest in a really heavy advocacy and linkage arm with communities, because science is changing, it's evolving, but we need to work together with the citizens to be able to demystify for them, how we're quickly able to come up with these products, but to the benefits of the products. So I think that's sort of one of the key things that we sort of had a challenge with, particularly across all groups, even healthcare workers who perhaps have the most knowledge in terms of COVID-19 pandemic compared to the general population. However, I can say, and I've seen the trend across the world, because we have our eye out on what's happening everywhere other than Kenya, it does improve. A few weeks into the vaccination drive, more and more people do come forward and are able to present themselves for vaccination. Of course, there's the key element in terms of, okay, so you have all these vaccine platforms available. How does a country make a decision in terms of utilizing this one platform? And while the COVAX facility has been greatly beneficial in availing these vaccines, I think that it may have been important for countries to reflect, particularly countries who are middle-income countries like ourselves. It may have been important to reflect and leverage on facilities such as COVAX and Africa CDC, but to also remember that there is still a role for bilateral engagement, because as you all know right now, we are caught up in between that frame where we have possible delays in COVAX deliveries, yet we had heavily leaned on those deliveries. So I think these are lessons for countries the world over that sort of have to have a very strategic plan in terms of ensuring that you have the adequate supplies of what you need. And of course, this touches on self-reliance as well. It does also, I dare say, bring into focus what true regional cooperation means. What does it mean to have Africa CDC present, and how can such a facility or institution provide agility in service provision? And they've done a fantastic job, I can tell you so far. Lots and lots of collaborations during the COVID-19 pandemic. Maybe it is that partnerships such as yourselves here, Corporate Council, need to support such organizations and sort of help them to be more agile and more responsive. It would have been great to have Africa CDC avail the vaccines at the same time as COVAX. Then now we'd have some confidence in terms of our current stocks. However, again, none of these challenges are insurmountable. I am confident we will sort of grow, build, and get out of this a little bit better than we were before. And particularly if we just take all these lessons and ensure we sort of form some implementable roadmap and reflections post this pandemic. So those are the key challenges. Over to you.
Thank you, Dr. Mercy. I'd love to come back to the resilience point at the end if we have some time, but really, really compelling. Thank you for sharing some of the challenges from Kenya in the early implementation phase. We all know how important the role of government can be when creating an enabling environment for collaborations between the private sector and the public sector. And we thank you and the government of Kenya for the leadership. Let me expand a bit more now and bring in some of the private sector voices that are deploying solutions to COVID-19 vaccine delivery. We are going to hear first from the aviation sector and from one of the top all-cargo airlines in Africa. Mr. Sanjeev Gadhia is the founder and CEO of Astral Aviation. Astral is an all-cargo airline based in Nairobi and operates a fleet of 14 cargo aircrafts into Europe and across Africa. A banker by profession, which I found very interesting. Sanjeev is responsible for the overall management, network planning, and fleet acquisition for Astral. Sanjeev, welcome. I want to ask you, share more about some of your current partnerships with the public-private sector, specifically related to COVID-19 vaccine delivery.
Thank you, Gerar. And I'm truly grateful for the opportunity of being here with all of you. And again, truly grateful to CCA for organizing this event, which enables a platform for learning and sharing ideas. Astral Aviation has been transporting vaccines and pharmaceutical products for the last 20 years. And we were very honored when UNICEF appointed us as one of their JV partners as a part of the Humanitarian Air Freight Initiative to transport the COVID vaccines to and within Africa. So currently we have two types of partnerships. Our first partnership is with UNICEF, who is responsible for the entire COVAX facility of procurement and delivery of the COVID vaccines to and within Africa. And we're also very grateful to UNICEF's partners, especially Queen Nagel, Gavi, African CDC, and also organizations which are directly and indirectly involved with UNICEF to make sure that the whole procurement and logistics of the COVID vaccines is done in an efficient manner. And we also have a second partnership, which is with the African Union. And with the African Union, they've actually set up a vaccine acquisition task team. And we're also very grateful to the African Union for also selecting us as one of their partners in the distribution of the COVID vaccines within Africa. So currently, we've already distributed 1.5 billion doses of vaccines within Africa, out of which 500,000 doses of the COVID vaccines were distributed on behalf of UNICEF. And this was actually done into South Sudan and into Yemen. And then we also did a very interesting drive of approximately 1 million doses of the COVID-19 vaccines on behalf of the African Union, which we delivered to 12 countries in Africa, which included about 10 countries in West Africa and 2 in East Africa. So we really believe in the importance of PPPs. Because to be very honest, when you look at the entire process of delivering the COVID vaccines to and within Africa, it is a massive exercise, and it cannot be done by one body or by one company. It has to be done under a collaborative effort. And the collaborative effort is a partnership between the private and the private sector, and the private and the public sector. So we're very grateful to be a part of the vaccine supply chain. And on our part, we will do everything that is possible to make sure that every country in Africa receives the COVID-19 vaccines, and there will not be any shortage of air freight capacity to make sure that the vaccines can be transported from the manufacturer, whether it is in India or whether it is in China or in Russia for that matter, into Africa. And we will actually do this within the shortest period of time and with the highest level of efficiency to make sure that we live up to the expectations of our clients.
Thank you, Sanjeev. That's very impressive. So let me ask you then, is it your perspective that African airlines can meet the logistical challenges related to all the needs on the continent?
I really believe it's not going to be easy for the African aviation sector to meet all the transportation of the COVID vaccines. As a matter of fact, currently 16 billion doses have already been supplied to 31 countries, but 95% of the COVID vaccines were actually transported by the Middle Eastern carriers. So along with Ethiopian Airlines and Astral Aviation, we've only got 5% of the share which has been given to us for the COVID vaccines which were transported to and within the continent. But that's not so much of a problem because it is a collaborative effort because the vaccines are actually procured and supplied from India. So when we transported the 500,000 doses of vaccines which were required for South Sudan and Yemen, we had to bring in the vaccines from Mumbai into Nairobi, and then we had to also bring in the syringes from Dubai into Nairobi. And then we had to now consolidate both the syringes and the vaccines onto one flight and then move it to South Sudan and Yemen. And this is exactly what we did for UNICEF. So we really believe that it's not really important whether it's an African airline or it's a European airline or a Middle Eastern airline which is going to transport the vaccines. What is really important is that the vaccines have to be transported within the shortest period of time to make sure that every country receives the vaccines. And there's no excuse that the vaccines were delayed or they've got spoiled because of the lack of air freight capacity. We just have to make sure that anybody and everybody should join the race for the transportation of the COVID vaccines within Africa.
Thank you. Let me just one more question. Dr. Mercy touched on some of the challenges from the government's perspective related to vaccine delivery. Say more from your perspective in terms of delivery in the aviation sector. What are some of the early challenges you're facing?
I believe the biggest challenge that we've actually faced is that there is simply a lack of infrastructure and cold storage. And I'm not talking about Kenya, but I'm just talking about Africa as a whole. Now, you might find it very interesting that there are only 4 airports in Africa which can handle the large-scale transportation and consolidation of the COVID-19 vaccines, and one of them is Nairobi. In Nairobi, we have almost 9,000 square meters of cold storage facility right at the airport, which will enable us to hold almost 50 million doses of vaccines for the whole of Africa. So we really believe that the entire transportation of the COVID vaccines will have to be done in a very careful manner. It has to go through the hubs of Nairobi, Johannesburg, Addis Ababa, and to a certain extent, Lagos. But we also have to realize that the biggest problem at the moment is not the infrastructure or the cold storage. The biggest problem is that we do not have a reliable and uninterrupted supply of vaccines from the manufacturers, especially in India. And this is really causing a very big concern, especially when it comes to planning and forecasting. We just believe that the whole supply chain has been delayed by the decision of the Indian government to put a temporary ban on the export of the COVID vaccines from India. So this is really going to be a setback, not a major setback, it's just one of the minor setbacks which will result in some delays for the COVID vaccines to reach Africa. But at the same time also there are some challenges with regards to the fact that a lot of the African airlines are not flying at the moment. It puts a lot of pressure on the cargo airlines like ourselves to go to very remote and distant airports to make sure that we can get the vaccines over there. So there are challenges, but in reality, we are there to make sure that we meet the challenges under a collaborative effort, and we make sure that everybody does everything that is required to play their part.
Thank you so much for that, Sanjeev. Really interesting. And as Dr. Mercy said, none of these challenges are insurmountable. I love that. I'm going to come back to that theme over and over again. Let me stay in the area of transport and shift gears now to another leading company, a household name for many of us, UPS. Esther Nadushi is the Vice President of International Community Relations for the UPS Foundation. Welcome, Esther. In her current role, Esther is aligning UPS's philanthropic footprint with local engagement in key international markets. Most relevant to today's conversation, Esther previously served as the Managing Director for UPS in Southern and Eastern Africa. She was responsible for managing the UPS business unit in South Africa, as well as the management of the network across 21 countries. Esther, you were instrumental in steering UPS through the COVID-19 crisis. Tell us how UPS leveraged their global partnerships to help increase the vaccine acquisition across the continent.
Thanks, Gerar. And thanks for that introduction. And thanks to CCA for inviting me to participate on this panel. So I guess for us at UPS, we've been engaged in one form or fashion in this space for quite a bit of time. So from a partnership perspective, we already had existing relationships with several humanitarian organizations. So the likes of Gavi, the Vaccine Alliance, UNICEF, WHO, and WFP. Given the work that we do, it's imperative for us to make sure we work with the governments in the countries that we operate in, which is pretty much any part of the world. So from a partnership perspective, some of those relationships had already been built and were already in existence. And it was just a question of us putting up our hands and saying, we're ready. What can we do to be able to provide the assistance in our technology or in our logistics network to be able to work with the governments to ensure that we could be able to roll out the vaccine campaigns. So I'll just look at, I'll start off from the top level. So looking at our relationship in the US, for instance, we were in the forefront working with the vaccine manufacturers. So between Pfizer and Moderna, keeping up with their plans on their rollout, the development, the requirements. So ensuring that we were working with either internally with our packaging experts to have the packaging required to roll out the vaccines, but also looking at what are the other enablers or what are the other parts of the supply chain that need to work for us to be able to deliver the vaccines where they need to go to. So we've also developed partnerships with refrigerator manufacturers. So we have one partnership with a packaging company and a refrigerator manufacturer that is able to build portable refrigerators that can be deployed when you send out the likes of the Pfizer vaccine, which require ultra cold temperature. And knowing very well, back to what Sanjeev just mentioned about the requirements in some of the countries, that they would not have the capabilities to be able to receive the vaccines. So that's one area we've looked at. We've also looked at our network. So given the fact that we already had a relationship with the likes of Pfizer and of course the humanitarian partners, we completed an assessment across the world to see what are our capabilities in each part of the country or in each country, and then how does that correspond with the vaccine requirements to allow us to be able to talk to what we can be able to do to each country or in each country. And then I guess going back to part of the work that we've done with the Gavi Alliance, we also looked at what skill sets are needed on the ground or what gaps are there on the ground for us to say, okay, fine, UPS has the capabilities in Rwanda. We already developed a drone delivery program in Rwanda with the likes of Zipline. How can we leverage that technology in other countries to be able to ensure that we can be able to deliver the technology? So for us, it's more than the network. It's providing our technology, our transportation knowledge, the packaging, and then also leveraging the skill sets that we have with our executives. So we have a loan executive program where we've been able to work with some of the humanitarian organizations to provide the technical support that's needed or capacity building that's needed to bring them up to as far as what the requirements would be and the considerations that the likes of Africa CDC need to have when looking at the networks and looking at the vaccine rollout in various programs. So to date, UPS has in the U.S. we've been part of the vaccine rollout, allowing 2 million doses to be delivered in the U.S. But above and beyond that, we have also been part and parcel of the delivery of about 150 million doses of vaccines to 51 countries, and with a foundation focusing on some of the lower and middle income countries to identify areas where we can provide our philanthropic efforts as well.
Thank you, Esther. You touched on some of the issues that Sanjeev has already raised as well, and it's really interesting to see how other parts of the supply chain are so critical to success, right? And when UPS is designing public-private partnerships, from your perspective, what should be the focus in related to vaccine delivery?
So when we look at what the what's most important for us, it's about the equitable distribution. So we've looked at the countries that are at most at risk. The reality is we have operations in 220 countries. So in every country out there, we either have a supplier, a customer, a family member, and so the needs really exceed, go across the board when you look at the different countries. But it's more on being able to leverage the strengths that you have as a private sector. So in our perspective, it's in the delivery. And our delivery ensures that we can be able to get those vaccines from point A to B with zero excursions. So what's needed? What do we need to have in place? What are we bringing to the table? So when you talk about zero excursions, what network do we have in place, or what systems do we have in place to ensure that those vaccines are delivered with zero excursions? Because it's one thing to say you've delivered, but another thing when I think that Dr. Mercy is the one who talked about the viability of the vaccines. And so from a responsibility perspective, it's important for us to make sure that we identify the niche areas where we can bring our strengths as a private sector company, and work, of course, along with the governments and with the pharmaceutical manufacturers as well.
Thank you very much, Esther. That being crystal clear about capabilities and gaps and where partnerships are most relevant, I think is so important. We'll come back to that theme as well. Thank you very much for your work and for sharing the perspectives from UPS. We've heard a little bit about already some challenges related to cold chain management and other aspects of the supply chain. Let me now switch gears a little bit and hear from a company that is a global leader in customizing packaging and warehouse services. Nicole Smith, welcome, is the Chief Operating Officer of Aldelano Corporation. Nicole has a long track record of developing innovative manufacturing and renewable energy solutions and bringing it to a global scale. Aldelano Corporation provides packaging and warehouse distribution services to large food and beverage and consumer manufacturers, a lot of household names that many of us know, including Procter & Gamble, Kellogg's, General Mills, American Airlines, and many others. Nicole, you've worked on bringing these so-called last mile solutions that are so critical in reaching populations across all corners of the world. Tell us from your perspective, how can the challenges of vaccine storage and distribution in rural areas be overcome?
Thank you, Gerar. I appreciate that. And like you said, our company, Aldelano Corporation, has been in business for 52 years with packaging, warehousing, and distribution solutions. A few years ago, we developed a new branch to our business, which is Aldelano Solar Solutions. And so as Aldelano Solar, we are global leaders in total off-grid solar solutions that incorporates refrigeration, freezing, water, ice, and auxiliary power. So basically what that means is that we've developed a solution that incorporates in containerized solutions using shipping containers, cold storage. So refrigeration and freezing storage. And the beauty of it is that it uses the power of solar. So now we can set up in rural areas, in areas that don't have a reliable power grid, where we are challenged with cold storage. And now how do we get these vaccines out to the rural areas? How do we get them distributed? How do we get them administered? Our units are plug and play, so literally in a shipping container, they can be set on the ground and you have an instant distribution center for the vaccines. We originally developed it more as an agricultural and food solution, but in response to the needs brought about by the pandemic, we've been able to customize that for vaccine storage. So it can literally just be a storage unit. It can also be an administration center where we customize a part of the container as a lab area. So it can be storage for supplies and for the waste receptacles and be customized in that way. So it can literally be a station where people come to receive their vaccine. Each unit can hold over 1 million doses, so it can also serve as a distribution center for the nearby areas as a storage area or location that can now distribute to the smaller centers. They can be placed at the airports. So as we found out, there's only a few airports that can handle the incoming vaccines because of cold storage limitations. Now we can place these at the airports where we can increase that cold storage capacity in more areas. So there's a lot of ways, that having portable off-grid cold storage can impact the supply chain and solve some of these issues that we're seeing. Okay.
Oh, thanks. That's very interesting, Esther. Let me, Nicole, sorry. Let me ask you the question that I had just asked Esther as well. From then the perspective of you and your business, what do you believe should be the focus in strengthening COVID-19 vaccine delivery, and what is missing and should be the focus of public-private partnerships?
Yeah, I think the key is really getting it to the people, getting it where it's needed. I mean, and then from my perspective, of course, there's a lot of things that have to happen upline, and those have been spoken to. But now as we build up confidence in the vaccine, as we build up the ability to bring in the vaccines and get them distributed around the various countries, now we have to get them to the people, and we have to make it easy to get to. And that's what I think we can offer in our solution.
Thank you so much, Nicole. Yeah. We have just a little bit more time before we go to questions from the participants. Please remember to drop in a question in the chat with your affiliation as well, and I'll be happy to include that as part of our conversation. We are very eager to hear from as many of you as possible throughout the session. As we do that, let me go back for a quick round robin and ask our panelists to touch on this resilience issue that Dr. Mercy mentioned earlier on. It's so important, and a lot has been said about equitable vaccine distribution, equitable response to COVID-19. I'd love to hear from all of you in terms of what are your recommendations for realizing what equitable access to vaccines mean from your sector's perspective. Let me start with you, Dr. Mercy, and then I'll go to Sanjeev.
Thank you. I think, when the pandemic hit us, I think the lesson of equity should have perhaps, carried much weight, because then if it had, by the time we got to production of vaccines and then their availability, perhaps a mechanism would have already been in place. And I'm talking about the initial shortage of PPEs. I think we all remember around March, April last year, each and every country was trying to, find PPEs. Countries were getting into manufacturing of PPEs. And, there was a clear lesson there and realization that we needed to really look at equity in availing these items, but also in having countries being resilient, in being able to have capacities to avail them. And I think right now, as we reflect on vaccines, and particularly knowing very well that public health security threats will continue to come at us, in years coming, I'm sure we'll be in another pandemic with another different, perhaps, virus, who knows? Then it's important perhaps then to see and ask ourselves these tough questions, particularly while participating and collaborating with the private sector. How do we get ready for the next pandemic in a manner where equity is not such a weighty and controversial discussion? And so I think one of the key things I'd be wanting to hear right now is, what is that ask that you have of government in terms of being able to facilitate that partnership that then ensures that we are better, particularly when it comes to equity? What would Gilead need, from the Kenyan government in terms of trying to come up with some form of construct arrangement. And it doesn't have to be a Kenyan specific arrangement. It is easy to perhaps even broaden it to the East African region and to say, this is how we're going to do this going forward. And so these are the discussions I think that would be particularly useful, even as we think about what happens next 3-4 years from now, and how do we build this infrastructure. And this is brick and mortar infrastructure, but also, I dare say, intellectual infrastructure in how to be able to move this forward. So I think that's sort of what's happening right now in Kenya. I think as government, I can tell you, this has been a wake-up call for us. And so we are, purposing to actually put in more domestic resources in our research organizations, and we're doing that. We'll be trying to build up the KEMRI facility in Kenya. And perhaps then to just let all of you know is that if you're there and you're a partner and you want to come in with us, Kenyan government is ready to put in resources and is ready to then come into a partnership with you, particularly when it comes to vaccine, manufacturing. And we can start with a small step of vaccine reconstitution. We don't have to go the full Monty. Let's just make a progressive step forward in sort of being self-reliant and, learning from this. I think the other second thing would be then, perhaps for the first time, countries are now more aware of the value of R&D. And, we've all sort of put in our necks there and, we're all reading publications and, we're in that space, globally. I think one of the things I've come to understand that it may be important, even as companies invest in R&D and clinical trials across the world, that governments who choose to participate in those clinical trials do then also get into negotiations of what happens after the clinical trials. And I mention this because Kenya is and continues to be a participant in the AstraZeneca clinical trial. And we're one of the first countries in Africa who jumped onto that and said, we want to do this. But I can also perhaps a bit too honestly, and I hope I'm not being presumptuous, say that beyond the clinical trial, we have struggled to extend that partnership to perhaps even having the provision of some of these vaccines in some way, form of priority, because Kenya opened up and said, we want to engage in this clinical trial. We want to help you in the R&D process, and we are here with our people, and we're going to do this with you. However, extending this to post the clinical trial, post the development area, I think we struggled a bit, and I would dare challenge each and every one of us that perhaps clinical trials need to go beyond the science and then get into then the business of, so then you found out this is going to be helpful. How do we get into those good collaborative symbiotic relationships post-clinical trials? So thank you, and over to you.
Thank you so much, Dr. Mercy. Sanjeev, what does equitable access to vaccines mean to you?
The word equitable access has been is actually been featuring in a lot of conversations in the last few months. And the reality is that there is a lack of equitable access, but it's not only in Africa, but it's also in other parts of the world, especially in Europe, even in countries like India. So when you look at a situation of Africa where we were promised 600 million doses of vaccines by the COVAX facility, currently we only have 3% of the 600 million doses, which is approximately 16 million doses of vaccines which were delivered to 31 countries in Africa as at yesterday. So we really have a big challenge ahead of us. We really need more vaccines to make sure that we get it over the next 8 months. But I really believe that also the importance of the government. I'm so grateful to the Kenyan government for supporting the pharmaceutical industries to actually set up manufacturing partnerships. And this is something which is very important, because I look forward to the day when I can transport an African-made vaccine to Africa. And this is something that we really look forward to. I know there's a lot of R&D, there's a lot of financial resources which are required, but one thing is for sure is that it's not only the pandemic that we are facing right now, but also for future pandemics. Would we be reliant on countries like India to meet Africa's requirements, or can Africa be in a position to produce its own vaccines? And I really believe that when you look at the words of Dr. Tedros, he's actually mentioned about 3 things which are very important on the whole topic of equitable access. And the first one is global solidarity. I really would like to twist that and make it into an African solidarity, to make sure that African countries have a solidarity plan, a resilient plan to actually make sure that they are self-sufficient and also independent in the future when it comes to the requirements for not only this COVID-19 vaccine, but also for future pandemics, which might actually come through. The second thing which is very important is collaboration. We've already talked about it, the collaboration between the private and the public sector, and also collaboration between the private and the private sector is also very important. The third area, which is also quite important, is information. And this is something which is lacking. It's really being not shared in the manner in which it is required when it comes to planning. And I really believe the fourth and the most important thing is urgent action. And this is something which is so important because we are now facing, we're in the middle of the third mutation. It's proving to be more deadly than what we experienced last year. And we really need urgent action. And I really cannot echo those words even louder because we really believe that until and unless we do not start receiving the vaccines urgently and in a manner in which it is in the spirits of true equitable access, then we're really going to lose the short-term battle against the COVID vaccine or against the pandemic. And I really believe that a combination of global solidarity, collaboration, information, and urgent action is required to enhance the equitable access of the vaccines in Africa.
Thank you so much, Sanjeev. And thank you for putting a finer point on that private collaboration as well. I know that's a big mission of Corporate Council on Africa and why we're doing today's panel. So we're hoping that this will stimulate some new ideas across the private sector and as well as with governments as well. Thank you for sharing your thoughts. Another reminder to the audience, I'm going to be soon turning to your questions. So please go ahead and drop your question in the chat as well as your affiliation. And I look forward to posing them to our panelists. Esther, let me ask you to come in here and share your thoughts on what equitable access and to delivery of vaccines mean to you and UPS.
Okay, thank you. So at UPS, we believe that, of course, as I mentioned earlier, with operations all over the world, all our employees are important. We've got 550,000 employees around the world. And when you take that to the next level, they're family members. So we already support a large group of the population around the world anyway, in one form or fashion: supplier, customer, employee, family member, the works. So for us, it's ensuring that we are able to leverage our skill set and our network to get to the countries most in need. So whilst we may have existing operations in Europe and the US and Asia, it's those countries that already had constraints or had insufficient supply chains in the first place, even before going into COVID. And we already had an idea, or we're already working one form or fashion with our health and humanitarian partners to either offer capacity building, capacity building initiatives, or training, or technical support for that perspective to those countries in the first place. So it's now taking it to the next level to ensure that with COVID, we are part of COVAX. We've partnered with COVAX and we've committed to providing, we initially started off with 20 million doses for countries with insufficient access. We've since expanded that and committed to $5 million worth of tools, in-kind transportation, and our expertise to those countries to ensure that we can be able to get vaccines to the countries most in need. I think there's the need, as I think Dr. Mercy said, the needs are insurmountable, and times 221, right? So every country has their has a request. Everybody's putting up their hand, looking for some support or some form of fashion. So ensuring that we prioritize that and work with the folks that actually have the footprint on the ground. So working with the likes of Gavi, the Vaccine Alliance, working with UNICEF, working with WFP. We've been working with WFP, for instance, now, because they were approached by the Africa CDC to look at the distribution into about 30 countries. So how can we, as UPS, offer our support, both in kind, both from a technical perspective and commercially as well, to ensure that we can be able to get vaccines into those countries?
Thank you so much, Esther. Nicole, you get the final word on this important topic, having the benefit of hearing from so many important themes that have already been raised, but I'd love your perspectives as well on this equitable access theme.
Yes, well, I appreciate being last because I get to piggyback on what everyone else has said. I really agree with Dr. Mercy that preparation is key. I think we need to anticipate that this is not the last time something like this is going to happen. So if we found ourselves unprepared this time, it is critical that we start preparing now for what could be the next time or the next time. Even with our equipment, it is, really ideal for disaster relief, disaster response, but no one wants to invest or think about it until the disaster happens. And then at that point, while we can move quickly, we find that they cannot move as quickly, and what would have been a great solution isn't able to manifest. And then still, we don't do it in preparation for the next time. We're focused on this, and then that dies down, and then we do it all over again. So I really feel preparation is key. And then, like I said before, just having a plan so that our solution can reach everyone, not just the industrial areas, not just the big cities, but really how do we reach those rural areas and the far-reaching communities so that we are not ignoring that sector of society, and having solutions in place that will work for everyone, right? Thank you.
No, thank you, Nicole. So panelists, stay with me. I'm going to switch gears now and turn to some of the questions that have come in. I just wanted to just pause for a moment, though, and really just highlight some of the themes that I've heard, which I love because they're so interconnected, and really it takes a village that we always say is so true as it relates to health, but especially now for COVID-19 delivery and response. Innovative partnerships, we heard a lot about innovative partnerships, not just public and private, which are so important, but also private. And I know there's some questions in the chat about that I'll raise. Dr. Mercy touched on what are some of the lasting changes that COVID-19 is bringing to the way her government is thinking about health and responding to health as a social and economic imperative, right? She talked about domestic resource mobilization, this idea for meaningful research and development, which I love. And Sanjeev said, we look forward to the day where we can transport an African-made vaccine on an African carrier, which is a dream that I know many of us share and I love, and such important theme. So with that, let me just see. We've got some questions here. I'm going to start with you, Dr. Mercy. There's a question from Kemri, from Ikoa Takizawa, from JICA, J-I-C-A. And the question is there a plan to promote partnership between public institutions with research capabilities, such as Kemri, with private pharmaceutical companies for strengthening local R&D in Kenya? Do you have any thoughts on that?
Yep. Thank you. Yes, I did come across the question, and quite excited by it because that's exactly what we're doing in Kenya. And just to really, should I say, paint the picture of how important this is to us, is that we actually now have a cabinet paper that's undergoing cabinet approval for this process. And so the idea is that we want to build, on Kemri. Kemri is Kenya's research agency in the health sector. So it's one of the agencies that's mandated with conducting research. And at the same time, Kenya enjoys very vibrant private sector research facilities and institutions that are available. And so what we want to do is to, just go ahead of this and really come up with almost a very symbiotic framework of how pharma can come and partner with Kemri, and also extend this partnership to the private sector players in academia in the country for us to be able to move this forward. So this is something that is, on the cabinet minister's table, and we've already actually submitted this to cabinet for approval. So very advanced stages.
Thank you, Dr. Mercy. Let me also ask you one other question and combine a couple of themes that I'm seeing in the chat. We don't have any vaccine manufacturers on the panel today, so I'm not going to ask our panelists to get into that. That's not in their wheelhouse. But I do want to ask, from the Kenyan government's perspective, if you have any thoughts in this regard. Darnley Howard asked the question around licensing beyond the current existing licensing frameworks that we've heard about. From your perspective, is the government ready? Are there local companies in Kenya that you're aware of that are ready to license and to be licensed and to manufacture COVID-19 vaccines? If you have any thoughts to share there, that'd be helpful.
So one, I think, he raises a very important point, particularly when it comes to intellectual property and patents and licensures. And one of the things that we're doing, particularly through the leadership of our president, Uhuru Kenyatta, is that he's engaging Africa CDC and the East African community to be able to come together as a bloc and perhaps find a way in which we can politely demand for these courtesies to be extended. And that's why if you look at what Africa CDC is doing, and I don't work in the African CDC, but I'm well aware of what they're doing. They've actually divided Africa into blocks and are in conversations, advanced conversations into how these licenses can be extended and most importantly linked with local pharmaceutical companies. And that is why I said earlier on when we were talking about equity, we recognize that capacities need to be built. We recognize that there are heavy investments when it comes to R&D. We recognize some of these pharmaceutical companies have been doing it for over 60 years. And of course, then, are 10 steps ahead. And so it's for us to then, come to a point where we say, this is how we start. This is what the first step would look like. And this is where capabilities such as reconstitution of these vaccines, can be done in Africa and in time build those capacities. And then of course have, commensurate government investment in this as well. And this is part of what we're looking at. It's interesting because 2 years ago, we already got into discussions with Merck to try and do this through a local pharmaceutical company in Kenya known as Dawa. And we were looking at, the BCG vaccine, which of course we know has been around for a very, very long time. And we're in quite advanced stages with Merck and Dawa to be able to then reconstitute that vaccine here in Kenya. So this is possible. Then of course in came COVID and here we are again discussing vaccines. So it's all possible.
It's all possible. Thank you, Dr. Mercy. I'm going to give you a break because we have a lot of other questions for you in the queue, but let me go to Nicole. Nicole, we have a question from Dr. Malcolm Beach, and he's asking, he represents the African Diaspora Business Roundtable. How can small and medium enterprise companies get involved in some of the cold chain work that your company is doing?
No, absolutely. Thank you, Dr. Beach. In terms of our organization, Aldelano, we have a program where we bring on independent sales reps so that we can hit, we can't hit all of the African countries and effectively get our message out, but through the use of, other companies, distributors, and independent reps and their relationships, we've been able to get the word out faster and on a more broad scale. So we currently have that program in place. We are also bringing our manufacturing to Africa. We've established a business in Nigeria and we will be manufacturing on the continent this year. So that will help us engage more local companies and be able to use the distribution methods and really get the word out. So we're working on solutions right now in both Sierra Leone and Nigeria for the vaccines and hoping that the word will continue to spread quickly through our partners.
Thanks, Nicole. Let me then pose a question to the private sector panelists. Invite you to come in on this question from Ladi Awosika. Dr. Ladi is from Total Health Trust in Nigeria. Thank you for joining us. The question is, what should the message to African governments be to get commitment to work with the private sector in order to scale up and reactivate the built capacity in serving some of these challenges that we've already faced? Dr. Mercy was so eloquent in sharing already some of the great work that Kenya is doing, but from Nicole, Sanjeev, Esther, we'll welcome your thoughts on this question as well. What more can governments do?
Gerar, I'll be quite happy to
just
step in over here. I really believe the governments are already doing a lot, but I really believe that they need to come up with very special incentives to encourage vaccine manufacturers to set up shop in Africa. I really believe that this incentives has to sort of be quite a large scale of incentives which are required, and I really believe that it's also requires the efforts of the African Union, who has to drive this whole initiative, because each country cannot really negotiate with the pharmaceutical manufacturers to set up a manufacturing facility in their country. We have to look at it from an African perspective, because we really believe that, going by the discussions that took place on a vaccine manufacturing conference, which was organized by the Africa CDC, we really believe that if individual countries in Africa go about it by themselves to negotiate with the manufacturers to set up facilities in their countries, and I really believe that that would be very selfish. They would really have to look at this from an African point of view rather than an individual country point of view, because this problem that we are facing is not being faced by a country, but it's being faced as a continent as a whole, because every country in Africa is having the same problems of equitable access. So we really believe that if there are manufacturing facilities which have to be set up, they would actually have to be set up rather than setting up in individual countries. Like one of the recommendations of the African CDC was to look at 5 regions where such facilities can actually be able to be set up. And there has to be incentives, there has to be various sorts of areas where they would actually have to open up. But I really believe that also the pharmaceutical manufacturers also have a responsibility to actually make sure that they play a part in which they provide participation at the local level. We often see a situation where you actually have this big fence which they create between the manufacturing facility and the rest of the private sector. We really believe that there has to be openness, there has to be transparency, and there has to be a transfer of technology. This is something which is a very sensitive topic. There's already talks about opening up, the whole discussion about manufacturing and actually providing some access to the patents. So I really believe that when one has to look at this whole situation, they have to do it with a very big heart. They really cannot look at this whole issue of local empowerment in a very selfish manner. It has to be done for the interest of the continent as a whole.
Thank you, Sanjeev. Esther?
Yeah, Gerar, I think if I can add to that, the one word that resonates so well with us during this crisis is agility, and the ability for us to be able to respond quickly. We can spend time trying to perfect certain things, certain systems and certain processes, but this virus was not waiting for that. This virus was not waiting for bureaucracy. It was moving. And if there's one thing we've learned, it's the ability to quickly adapt, quickly change, and allow innovations to take place, allow the private sector to explore, while at the same time, of course, being cognizant of all public health restrictions and public health, and being mindful of the public health. We saw, for instance, when we rolled out the drone program in Rwanda in 2015, with the help of Zipline, Rwanda put up their hands and said, we are willing to try this, we want to do this. Fast forward 2021, we're now using the same network that we put in place a few years ago and was being used to deliver blood, to be able to make sure that they can be able to get vaccines out to remote parts of the country. We rolled out the same program in Ghana a few years ago. Now, on the flip side of that, there were countries that we had approached before that were not willing, and at this point are now putting up their hands and saying, we need to be able to figure out how we can quickly get these vaccines out to the remote countries or the remote parts of the countries that we weren't able to. So I think agility, and agility is a big word for me, but then also just openness to work with the private sector, openness to be criticized. I think Dr. Mercy mentioned it's a 50-50 split in Kenya, and it's very similar. And in some cases, in other parts of the world, the private sector's engagement in the public health is actually far more than what the government can be able to handle, the disease burden in the countries. And not to mention, you add on to that a pandemic that's taking place. So you already had problems, you already had issues being able to get to the remote areas or the people in need. So I think the agility and then lack of bureaucracy and openness and willingness to work with the private sector.
I love that. Thank you, Esther. Thanks for raising that word agility, which I know is true even from Gilead Sciences' own response to COVID-19. So thank you very much. Nicole, did you want to get in on this question as well?
Yes, thank you. I really like what Esther said, and I'm trying to choose my words carefully and be politically correct, which I'm not always very good at, but it can be challenging to do business with the governments in Africa. When we first rolled out our solution, we thought that was really the best place for us to start, is with the government who can control bringing in solutions and getting the products in the hands of those who need them most. And in hindsight, we would not have done it that same way again. We would have gone to the private sector first, who is equipped to make decisions and move quickly, which is not always the case with the government. So just, that agility, being able to move quickly, being able to make decisions, not slowing the process down with bureaucracy. And I understand as a US-based company, we're not always savvy to the customs and the way things work, and the very formal letters and things that we've had to learn along the way. But the amount of times we've gotten requests, okay, well, send your product, let us test it, let us try it, bring in a free one. And these are not small pieces of equipment. So that's not always something that we can accommodate. So being, just easy to work with, let's work together to bring the solution in. And sometimes it feels like we are working against each other more than with each other.
Thank you, Nicole. Thank you very much. I just wanted to mention that Dr. Mercy has also kindly dropped her email in the chat for those who want to get in touch with her directly. Thank you for doing that, Dr. Mercy. We're getting close to the time. There are just a couple other questions there. I'm going to try to summarize in a larger context here. But if folks have any other burning questions, please do so in the next couple minutes. And as we just transition, I want to just ask one question that I see here is for the logistics and transportation industry or aviation. Curious how the COVID-19 pandemic has driven innovation and new ways of doing business for your companies. You've touched on some of this already, but in the manner that Dr. Mercy talked about, lasting changes in the way the government thinks about it in response to health, what are some of the lasting changes that you think that this responding to this pandemic can bring to your respective sectors? Open for Sanjeev, Esther, or Nicole.
Thank you, Gerar. I really believe that innovation is very important. And innovation will come at the right time, at the right place. And we really believe that there's a lot of innovation going on in the last mile delivery. We're already seeing countries like Ghana and Rwanda using drones for the last mile delivery. We are also undertaking a major pilot project in Kenya, where we would be using our drones for the last mile delivery of the COVID vaccines. We've already set up a pilot project which involves various stakeholders. And I really believe that whereas we're very fortunate in Kenya to have a fantastic infrastructure where we can be able to reach different parts of Kenya at the shortest possible time, there are many other countries in Africa which do not have the same privilege, especially when you look at countries like the DRC, Sudan. These are countries which have very, very major problems when it comes to the last mile delivery. So we really believe that one has to look at an innovative strategy. There's a lot of innovation that is also taking place in the transportation. There's also a lot of innovation taking place in the containers which are going to be storing the COVID vaccines. We really believe that UPS, Gavi, the Vaccine Alliance have already encouraged private sector innovation in various aspects. And I really believe that it's a combination of innovations that are required to meet the last mile delivery of the COVID vaccines. And I really believe that there is a very bright future for African tech entrepreneurs to actually come up with various forms of innovation, whether it's tracking devices, whether it is temperature controlled storage containers. We already seeing some of these containers coming in from China, I really don't believe it's something which is very difficult for our entrepreneurs in Africa to manufacture specialized containers which can actually be able to keep the vaccines cool for a longer period of time. And we really believe that it is a combination of innovation and also a positive mindset that we will actually be able to make sure that the last mile delivery of the COVID vaccines will reach every town, every village in the most remotest locations in Africa to make sure that everybody has got the jab.
Thank you, Sanjeev. Esther and Nicole, I invite you to come in on this topic as well. And let me just amend it briefly with another question that's come in with regards to this innovation. Are your respective companies open to more local partnerships? Chike Anyankor from J&J is asking, how can these logistical organizations enable smaller in-country companies to deliver a vaccine and improve access to remote and hard to reach populations? Factor in some of the local partnerships that you must be engaging with at the local level as well. Thank you. Esther?
So for us, UPS, we already have the UPS Healthcare, which is one of the divisions within the organization that has been in the forefront of looking at the distribution of pharmaceuticals, ensuring that we've got the entire chain available for us to be able to support our pharma customers. So from that forefront, we already had a certain framework in place. So it was ensuring that we can be able to leverage what we had done in our headquarters, or our main port, which is in Louisville. We also have a large port in Amsterdam. And so ensuring that we can be able to take that and blow it up into other, and move it into, or implement it into other parts of the world as well. So maybe not at the same degree, but a smaller version or tweaked version of it. From a technology perspective, I talked to the monitoring capabilities. When I talked to the zero excursions, we have a control tower that we put in place to ensure that we are monitoring all the trackers for all the medical shipments that are going out there, vaccine shipments that are going out. And we are able to ensure that by the time they get from point A to B, if there was any type of temperature excursion or not, well, not excursion, but if there's a need for us to go back and re-ice, replug, that information has already been made available to the destination country or to the next stop within our network, so that we can make sure that we maintain the temperatures and of the vaccines. So that's UPS Healthcare, and that system's been in place, and it's more about leveraging what we've already had in place within the organization. From a foundation perspective, we have, as I've mentioned, existing relationships. So it's looking at what are their needs on the ground. The likes of UNICEF involved in the distribution of vaccines anyway, before COVID or before the pandemic hit. What type of tracking capabilities do they have? What are their needs on the ground, and what can we be able to do to be able to offer the funding that's needed, because that's usually one of the challenges, is the funding as well as the technical support. And I did talk to the drones, which is something that we've done in now looking at. We've done Ghana, we've done Rwanda. We've rolled that out in the US. We've rolled that out in in other markets in North America, so Canada. So what else can we be able to do to ensure that we're able to leverage those drones, the drone systems that we use? The question on SMEs, our first drone partnership was with an SME. Zipline, when the guys came to us, Keller, they had minimal funding and looked at UPS for funding opportunities and partnership opportunities. We provided them with seed money, and as a result, I don't even want to imagine how much money the company is worth now, because they've been able to leverage what the initial seed money they received from UPS to attract more funding and also to roll out their work into other countries. So from an SME perspective, back to the question on us working with partners, we have a UPS Enterprise Fund. So the Enterprise Fund looks at, within our value chain, who else can we work with out there to be able to develop tools or develop processes or develop systems to allow us to be able to get our goods from point A to B. So we're open to that. I can send my information as well, just to get some more information from we'll ask that question on their specific area of expertise. The reality is we can, even though we have 550,000 employees, our core function is to be able to get goods from point A to B. And then we will leverage other suppliers to be able to get to point A to B in the most efficient manner. So open to getting more information or offering you more information on the work we've done with SMEs or how you can partner with us.
Excellent. Thank you so much, Esther. Really appreciate those insights. Nicole, I'm going to give you the final word on this topic, and then we'll wrap up.
Okay, thank you. I really think that's the beauty of working with the private sector, is our ability to bring innovative solutions to the table, to be agile, to move quickly, to customize, and to come up with those solutions quickly. We are benefited, like I spoke before, about working with other partners on the ground who have the ability to get our products introduced to the right players and to support our efforts on the ground from a local standpoint. It's an excellent business opportunity, even as a distributor, when we talk about financing opportunities. This is something that we can work with equipment rental companies on, for example, to really get things in the hands of government quickly. With the distributors who can offer financing, we have relationships with SM Bank and other ex-M Bank and other financiers so that we can help our customers through some financing opportunities and even some funding opportunities. So we're problem solvers. That's what we do. So we've worked really hard at putting the systems in place, and we're normally able to come up with very innovative and creative solutions. So again, I think that is the benefit of working with the private sector.
Super. Thank you again, Nicole, and really thank you to all of our panelists for a rich discussion. Thank you to the audience as well for the questions. I appreciate the honesty that you've all approached the topic today. And in particular, I wanted to thank Dr. Mercy for sharing the perspectives of the Kenyan government, as well as your leadership, not only on COVID-19, but we know for a long time as it relates to UHC and other health challenges. So thank you very much for making time to be with us. I just wanted to quickly share that the pandemic has changed the way we all work and live, of course, and overcoming this global health crisis will require innovative solutions, deepening engagements, and collaborations among public, private. You've heard this theme over and over again today. That's the only way we're going to get out of this crisis. And as we do that, we must also not take our foot off the pedal in responding to other health challenges that many countries are facing, including HIV/AIDS, TB, cancer, as well as pushing forward on efforts by governments like in Kenya to pursue universal health coverage for its populations, because ultimately that is what's going to help respond and prevent the next pandemic and the next health challenges in the years ahead. I wanted to say just a huge thank you to frontline healthcare workers that have been working long hours in hospitals, community healthcare workers as well that are now being deployed in many countries that are working to put vaccine jabs in the arms of many people. Thank you to those workers. Thank you to frontline workers that have never stopped working in our grocery stores, our local corner stores, postal offices, and other places that we rely on every day. And I just wanted to also thank, again, the private sector, for the representatives here, for their unprecedented response and collaboration from the very beginning of this crisis. You saw today, we heard some examples about working on some last mile solutions and scaling some of these proven health innovations are the only way out of this pandemic. And truly, I think, as I'll come back to what Dr. Mercy said, which is none of these challenges are insurmountable. And I love that. And I hope that can be our call to action moving forward. So with that, I just wanted to, again, a huge thank you to Flory and the CCA team for creating this space to have this honest dialogue. And we look forward to future opportunities to engage again. Thank you, everybody, for being with us.